I guess what I'm hoping we all are able to today is get to know each other. I think that's the value of a meeting like this is very cross-disciplinary, very multidisciplinary, and very people here are passionate about what they do. And Sheena Mahan, thank you for putting this together. It's important to organize at this critical point of a new technology bursting forward and having such profound implications that we address some of the issues that you're focused on, addressing equity and addressing how we can make sure that this technology is shepherded in the right way. So I'm looking forward to spending some time with each of you and, well, as many of you as I can. And let me start with my presentation here. I should mention healthcare is very broad, as everybody knows, and AI is having such broad implications. So I've tried to put together a very brief overview of what's going on. And it's going to be shallow. It's going to be bringing up the topics and addressing some of the issues that we should pay attention to. But because of the time constraints, we're not going to be able to go too deep. Hopefully, it will spark some discussion. Now, it's important to keep in mind that AI's applications within the medical arena is based on in the context of digital healthcare. There's been a revolution over the last 10 or 15 years of moving from a very analog world with handwritten records and ink on paper as our way of collecting information to now digital healthcare is becoming an important part of how we do things in healthcare. And that really has been a quite dramatic change. And AI's applications are coasting on top of that framework of digital healthcare. And AI is serving to converge all the different sectors, telehealth, remote monitoring, wearables, digital therapeutics, and in my particular field, how we can use extended reality technologies as part of healthcare. So it's amazing to see how this evolution of technology is weaving together many of the aspects that have been separate and disparate within our healthcare ecosystem. The numbers are quite impressive at this snapshot today. Almost 200 billion is the projected AI healthcare market by 2030. I was surprised by the statistics of more than 60% of the physicians in the US today are using AI tools. And we have more than 1,200 FDA-cleared AI medical devices. It's really quite impressive in a short amount of time. And let's look at where AI is making an impact. And again, these are very broad categories, but they're very substantial. Improved diagnostics and imaging, new ways to do surgery, robotic surgery with surgical guidance and smart instruments, profound improvements in improving the veracity and the speed of drug discovery, improvements in patient monitoring. And this is actually quite profound because we're leveraging not just what we can collect inside the clinic, but what happens while we're at home and out in our environment. Improved ways of supporting decisions clinically. And then, of course, we've been going through a crisis in mental health over the last 5 to 10 years, especially in our youth. And it's a challenge, but we're coming up with new tools of how to leverage AI. But that is one particular area where we need to be very careful. There's also been a lot of misuses of technology in that arena. So let me just describe some of the 4 broad areas of healthcare and AI: clinical tools, consumer applications, business operations within the business of healthcare, and then applications that cross over among those categories. Ambient scribes, ways for patient navigation, tools that help both healthcare, clinical care, and operations within the clinical environment. And I would say if we want to find out where is it most mature within healthcare right now, it's diagnostics. Medical imaging, radiology, ophthalmology, pathology, ECG interpretation, empowered by AI analytics. Pattern recognition is one thing that AI is particularly good at, helping us understand the fine details that otherwise we would not be able to catch. And one of the most credible roles is being a second reader for decision support, not on-monitored autonomy. So just to give some examples, some statistics, and these are impressive to me. With mammography, almost 20% more cancers detected in a clinical trial in Germany. In diabetic retinopathy screening, huge increases in the sensitivity to do that screening. For pathology, AI is able to exceed what we're able to do with human pathologists. ECG, well, many of you are probably wearing a wearable sensor that's looking at your heart rate and interpreting it using AI as part of that system. And then improvement in AI interpretation chest x-rays at a point of emergency triage. Really important, useful tool. So I think what we're seeing is a switch from episodic care to continuous monitoring. With the advent of wearable sensor technology, we're now able, and it's not just the things we wear. Right now, our smartphones are collecting information about where we're driving, who we're interacting with, how fast we're typing. This will be empowered in a major way, the sort of interpretation of our behavioral data, if we opt in to share it, as a way of understanding our mental health, our behavioral health, our physical health, with this very powerful data systems that are just part of how we interact with each other, interact with the world. Interpreting this data can help us understand quite a bit about our cognitive state, about our emotional state, about our overall health. So it's going to be going beyond just understanding our steps, but understanding the context of how we are within our family, within our community, within our country. And I think this data layer of interpretation of very complex data is going to allow us to understand so much more about personal health to population health. And things are scaling fast. Within the hospital ecosystem, ambient AI is helping us relieve the burden of note-taking, coding and billing, scheduling and routing resources within a hospital. So these tools may not be viewed as clinical tools, but helping a complex ecosystem, such as a busy clinic or busy hospital, do more and be more efficient in the use of resources is so critical. As you know, our healthcare system has been overburdened. It's complex, it's busy, resources are tight. So tools that help us be more efficient are so important, and that's where AI is scaling right now. And I'm excited as a research scientist to see what's been happening with the applications of AI in terms of advancing and accelerating research. AlphaFold is a great example, one of the early projects that leveraged AI to come up with new protein structures, designing new molecules, predicting drug-target interactions, optimizing clinical trials, supporting distributed clinical trials, genomics and precision medicine, and ways to help us look through the large body of literature that is in a field. It's hard to stay on top of it, but AI can help us summarize and get a handle on it and understand it in the way that we want to extract the data. So there's so many different areas that AI is being implicated and leveraged within the healthcare ecosystem. What I like is the fact that we so far have been really good at keeping the patient's needs at the center of design and understanding. We need to always do this. But pharmaceutical firms are leveraging AI as part of their drug discovery and design, coming up with precision therapies. So it might not just one size fits all. If there's several different subtypes of depression, for example, using AI analytics, we can understand the individual, match them to the right intervention, instead of saying, okay, try this drug and see how it works. And if it doesn't, we'll try something else. We can now do predictive modeling, understand what subtype an individual is, and do a better job of matching them to medications. Providers leveraging AI, as we talked about, payers understanding what's the most effective way to use their resources to help reimburse for appropriate care. The medical tech companies are using this to help us with their design of products and, again, personalizing them. We've talked about services and operations, how that is leveraged by more efficiencies within the clinic, and our public health agencies have access now that, should they choose to do the right thing, leverage that data and use it the right way. But again, we need to keep the patient at the center of this. This is so key. And I'll talk a little bit later about how we can design for patient authority over their data and over the direction things are going. So let's look at the economics right now. the accessible market, as estimated, is huge, and it is growing. And it's then AI is projected to grow faster in healthcare than in any other industry. So this is very important. Right now, healthcare represents almost a quarter of the U.S. economy. If we want to improve efficiency within healthcare, it will have a dramatic impact on the overall economy, but it's something that we need to do with great care to make sure we do it right. There's a trade-off, as you realize, that moving fast to address some of the big problems we have is so important, but we also have to be careful and make sure we design for equity and accessibility and keeping the patient as the center and giving the patient authority over their data. But the economics of growth of the investment opportunities in healthcare are substantial. So I think one thing we should keep in mind is one of the major things that will change, that will be visible to all of us. There's a lot going on behind the scenes, but we'll see the change in workflow. It's not just the software tools we're using, but how we're using the tools and how clinicians are spending their time. They will evolve from the role they have right now of sometimes seeing a patient every 15 or 20 minutes and having a lot of burdensome paperwork to do, to now being more of a helicopter perspective on patients and being a coach and interpretation of the data leveraged by AI tools. So with decision support, improvements in documentation, it will improve the efficiency of the clinician to be more of a data manager and a coach and advocate for the patient. I'm sure everybody's aware of this. We're not going to be replacing clinicians with AI. We're going to be providing tools to clinicians to leverage AI to do their work more efficiently and with greater veracity. So what do we have to pay attention to as we move forward? Safety, validation, and addressing the issues of liability. We have to watch out for model drift. AI can degrade as data and equipment changes unless we stay on top of it. Validation. We're moving so fast, and we need to make sure that we take the time to validate correctly and not just race forward, even though some of the issues that we're addressing are quite urgent. We need to make sure that we have rigorous clinical trials, which often in the speed to bring a product to market is not adequately addressed. And we're still in a regulatory and legal framework having challenges with legal uncertainty and liability uncertainty. When AI makes a mistake, who's responsible? Is it the designer of the product? Is it the user of the product? Is the supervisor of the project? And we have to watch out for overlying on AI, make sure there's always a human in the loop, human supervision. And again, to watch out for drift, we have to make sure after a device is approved, moves forward, we need to make sure there's continuous post-market surveillance to make sure it's doing what it was designed to do, despite updates and changes in data sets and algorithms. And it's not just the design of the system that's a trouble, it's the implementation of the products in the whole social technology system. We need to always continuously refresh, remind ourselves to go back and check again to make sure that the black box data sets that we have are appropriate, unbiased, and equitable. So let me address some of the ethical questions. Again, for the sake of time, I've had to be very brief about this, but we need to make sure that our data sets aren't biased. As we do research, we need to make sure that it's not just those people who have access to a major medical center or research center. We need to leverage distributed clinical trials and collect data from underserved populations. Addressing data rights and privacy. Again, data will become a commodity as we move forward. Healthcare data will be so precious to empower these systems. But unless we're careful to provide agency to the individual who is providing that data, it's going to be a challenge. And also, as a neuroscientist, I am very concerned about the fact that now we can collect facial expressions, eye gaze data, voice tone data, behavioral data to come up with a measurement of cognitive emotional status of an individual. We can do that with the information we're transmitting right now in this room with AI interpretation. So how do we keep that very precious data private and not allow others to use it to exploit us, to influence our buying decisions or our how we vote. So as we move forward with leveraging technology to provide better measurement tools for psychiatry, psychology, and coaching, we need to make sure that that very personal data about our goals, our aspirations, our cognitive and our emotional state is kept down in a locked way that we can have control over an agency over it. We need to make sure that as we develop these systems that we can have proper design and review of the system, especially when it comes to high-stake issues. Again, liability and accountability is yet to be worked out, and we need to make sure patients know when AI is used as part of their care. That's something that is, in my opinion, a right that we should have. It's more than just better algorithms. We need to, have the right data sets. We need to use it in the right infrastructure way, so there's a design criteria there. Patients and clinicians both need to trust AI, and that's a big problem right now. I learned earlier today that a huge percentage of people in our country don't trust AI. Now, this might be because of some of the movies we've watched about AI taking over the world, but right now, I think we should be optimistic but careful and look forward to using technology the right way as long as we take the effort to design it up front. I think design is going to be a key consideration moving forward. And of course, there's no way we can have equitable access to technology unless we make it affordable. So design needs to focus on making the systems not just powerful, but also affordable. I love the question about, and this is related to the equity issue, the future is already here. It's just not very evenly distributed, from the author William Gibson. We have so many amazing systems out there in academic medical centers and in research groups. We need to move them forward in a way that is designed for equitability and access. And that's part of what this conference is all about. How are we doing in terms of time? 10 minutes? 3 minutes. Okay, not too bad. So there's risks, of course, and there's opportunities. There's a balance between those two. I'm very concerned about the regulatory aspects of this emerging technology. Our legislatures have not moved to address the challenge. Governance is very fragmented, and we need to take responsibility as developers and designers of these products to make sure that we self-regulate, design for the right safety, equitability, and accessibility of these products. The FDA is doing their best to provide oversight, but it's something where I think we're going to have a lot of challenges as we move forward maintaining this. Our legislatures are not keeping up the talk of the speed of change, and it's something it's worthy of an enhanced dialogue to go into greater detail. Again, the workforce is going to change in healthcare because of this, but I think it can be designed to do so in such a positive way. And so let me just summarize by talking about some of the trends that will shape the next wave. I think we will see, of course, ambient AI is already taking over to support clinical documentation. That will go deeper and become something in the background. Agentic workflows, I think we're going to be seeing that as just part of how we do care, is having these systems in the back helping us maintain smooth workflow. I think continuous monitoring is going to be a given. That our healthcare data, and again, we need to have agency over this data, but should we elect, we can provide this to our clinicians in a really robust manner using passive and ambient sensors. And I think the digital therapeutics are going to surge, that the digital infrastructure, as represented in this design here, is going to provide so much in terms of a research bed for understanding and developing new systems. The paradigm shift is going to be emphasizing well-being and wellness, as opposed to waiting until things go off the rails and we have to deal with a very difficult clinical issue. Every individual will become a clinician in many ways. We'll provide agency to the individual to understand their healthcare, make corrective choices with the information that's provided. Again, a design issue. And then we're going to see, hopefully, healthcare reach underserved areas by being able to provide what can be the best in any one area, should be the best in every area. The main bottleneck is not invention, it's implementation evaluation, governance, and trust. I think that's our biggest challenge right now. We have some great ideas, great technologies, but we have to move it with, again, a design focused on privacy, explainability, accountability, and equity. Those are not side constraints. They're the heart of what we need to have as part of our design principles. So key takeaways, AI is augmenting, not replacing clinical care. Success requires disciplined governance, equity, and transparency. We're behind on that. Adoption must shift from hype to measurable outcomes. We have a lot of hype right now, but we need to emphasize where it's been successful. And building a responsible ecosystem for evaluating and monitoring is essential. Thank you very much. I was visiting a few days ago at the Center for Brain Health, which is part of the University of Texas at Dallas. They've been focusing on coming up with new ways to help us as we go through life, maintain our brain health, just like paying attention to our heart health is important. Brain health is also very important. And they put together this video, which I think is important.
Strong brain health is the best defense and offense in the AI era. Today, we're navigating constant trade-offs, speed versus depth, convenience versus growth. And here's why that matters. Brains grow through what psychologists call desirable difficulty. Like resistance training at the gym, some level of challenge builds capability over time. Your brain is the most modifiable part of your body. Working through a challenge stimulates systems responsible for problem solving, critical thinking, and memory, which in turn strengthens them. For the brain, it's about this process, not just about the end product. Up until very recently, many of these challenges, while desirable, weren't voluntary. You had to work through them yourself. Now AI has changed that. We can now opt out of desirable difficulty all the time, but we need to be aware of the risk of constantly opting out. When we routinely offload thinking, we stop engaging our frontal networks. Over time, habitual reliance on AI will replace active learning, creativity, and judgment with automated responses rather than strengthening those skills. Those with strong executive functioning skills tend to use AI to extend their capabilities, while those with weaker skills are more likely to let AI replace thinking altogether. Don't let this happen. Take advantage of your brain's neuroplasticity and choose challenge on purpose. Try driving without your GPS. Sit with a question or problem for a few minutes before looking for an answer, or even practice balancing on one foot while brushing your teeth. Practice desirable difficulty and develop the skills that make you uniquely you.